Step by step, we're going to figure this out, and we're going to find a way through this.
We're working really, really hard in the hospitals, our nurses, our techs, all the docs.
It's about staggering when people get it so that the hospitals can cope.
We're going to go through an awful lot of these.
All across Puget Sound, people have been stepping up and donating personal protective equipment.
We stay at work.
For you.
You stay at home for us.
Just know we're all with you.
Thank you.
Thank you. Thank you so much.
Thank you, doctors and nurses.
Good day. That video shows how it takes to become a healthcare professional and support from others. For this second week, it is a continuation from last week's lesson, Healthcare as a Profession. There are many challenges in clinical education that future healthcare providers have to navigate. 2 years from now, you will be a health professional student which will be assigned to clinical sites, and your clinical practice is conducted in parallel with your didactic paths. Hence, it is deemed necessary for you to understand the values and professional qualities of each healthcare profession. So for this week, we will be discussing the specific topics on, first, the definition of nurse, pharmacist, and medical technologist. Second, professional leadership. What are the characteristics of an effective leader? Third, qualifications and abilities of a health professional. And fourth, professional handling of difficult situation. So at the end of this session, you will be able to classify personal traits or attitudes and professional characteristics desirable in a member of a healthcare team and portray the characteristics of a true medical practitioner. So healthcare as a profession. So just additional information from last week. When we see healthcare, it is relating to providing medical services. It is defined as the prevention and treatment of diseases through medical professional services. So by this definition, healthcare careers do not just include doctors, nurses, and other frontline clinicians who often come to mind first when people think of healthcare jobs. It also includes administrators, therapists, chiropractors, paramedics, and technology professionals all have a place in helping people to live well. So that's what meant by healthcare. So for profession, it is a job at which someone works and for which they have had training. So you've learned last week that profession comes from the root word profess. And when we say profess, it means to show, demonstrate, or manifest. And it also expertise or specialization. It is also a calling, which means vocation. So a profession is a disciplined group of individuals who adhere to ethical standards and who hold themselves out as and are accepted by the public as possessing special knowledge and skills in a widely recognized body of learning derived from research, education, and training at a high level, and who are prepared to apply this knowledge and exercise these skills in the interest of others. So now let's define a nurse. So what is a nurse profession for you? So one who advise and instruct individuals, families, groups, and communities in the prevention and treatment of illnesses, diseases, and in the promotion of health. So in other words, a nurse is a licensed healthcare professional. So nurse is a skilled person in promoting and maintaining health. Right? So nurses encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, both sick or well, and in all settings. So nurses' tasks includes the promotion of health, prevention of illnesses, the care of ill, disabled, and dying people, Moreover, nurses' roles are advocacy, promotion of safe environment, research, participation in shaping health policy, and inpatient and health system management and education. Now, what is a pharmacist profession for you? So when we say pharmacist, so they dispense medication, monitor patients' health, and make sure that drugs do not interact in a harmful way. So pharmacists are also known chemists. They are also known as druggists. There, they are specialized in the use of medicine. There, because they deal with composition, effects, mechanism of action, and proper effective use of drugs. So they are medication experts. Because they play a critical role in helping people get the best result from their medication. So they are involved in all aspects of medicine delivery to patients. They will prepare and package medication that a doctor has prescribed and also sell medication over the counter. So as you can see, they are located as well in some drugstores. Okay, so pharmacists play a key role in helping patients feel better and get well as quickly as possible. Patients do best when pharmacists are part of their healthcare teams because pharmacists are medication specialists, as what I've mentioned, and pharmacists improve medication adherence. So they are culturally competent healthcare providers who communicate effectively to evaluate many factors that affects a patient's ability to take a medication. And this includes the diet, the lifestyle, transportation, or any language barriers, and much more. Then what is medical technologist profession for you? So they deal with examination of tissues, secretions, excretion of human body and fluids by various electronic, chemical, microscopic, and other medical laboratory procedures or technique other than manual or automated. So for medical technologists, they are also known as clinical laboratory scientists. They are also known as medical laboratory scientists. Or medical laboratory technologists. And all of this one, they examine specimens such as urine. We have the blood. We have the sputum. And when we say sputum, this is the phlegm. We have pleural fluid. When we say pleural, this is located or found inside the lungs. We have also bone marrow. We have also stool. And when we say stool, this is the feces. And many more specimens. So medical technologists work in all areas of lab, including immunology. And when we say immunology, this is for the immune system. We have microbiology. So for any viruses or bacteria, we have the genetics, the genes, histology, tissues. We have the hematology. And when we say hematology, from the word hema means blood. We have chemistry. And of course, blood banking. So medical technologies hold life and death in their hands because the information they give to the doctor influences the medical treatment a patient receives. So medical technologies do much more than examining specimens through a microscope, and they operate complex electronic equipment, computers, and precision instruments. So if some of you have already visited Cagayan Valley Medical Center, you can see their laboratory, and you can see there the complex instruments that they're using to check specimens. So we have now the leadership. So when we say leadership, it means encouraging people to work together and do their best to achieve common goals. So how can be a healthcare as a profession be a leader? So first, it's of course through communication. So communication on an individual basis is also key. If a member of your team is struggling with a certain task, and take time to help that team member hone his or her abilities. Second one is listening and learning. So learning is a part of communication, but it deserves its own mention because it is so vital to advancing your team. So be humble enough to listen to others' ideas. An open door policy can help create an atmosphere where everyone is comfortable speaking up. Third, we have flexibility. So as a leader, you are bound to face curveballs. So have a flexible mindset and be willing to adapt to new situations. So for example, you should be diligent in learning about using the latest advances in electronic records or any advances in terms of the instruments. And fourth one is planning and vision. Okay, so effective leaders have a clear vision of what success will look like in a specific time period. They know how to plan for it, how to communicate and direct it, and how to implement it. They dream big and look forward to overcoming the challenges their vision will face. So analyze the goals and break them into smaller, measurable goals that can help you and your team stay on track. And when one approach or method for reaching goals doesn't work, be prepared to make adjustment. So the best way to find yourself is to lose yourself in the service of others. As you can see, what is happening right now with the pandemic of coronavirus, healthcare providers are really sacrificing in the service of others to really help reduce the number of cases of patients being infected for the coronavirus. And it is not how much you do, but how much you put into the doing that matters. So we really do our best in providing care to our patient. So we have now the characteristics of effective leaders in healthcare. So first is a high level of competence in their profession. So becoming a competent at a skill allows you to perform it with ease, boosting your productivity and increasing your performance in the workplace. So by improving the level of competency, it will give you the ability to impart your knowledge to others. It will also improve competency in the workforce. So if you're going to understand this competency, it will allow you to effectively employ strategies to move rapidly from one to the other. So when we say competence, this is skill and characteristics. Okay, so that enable you to perform in a job. So if someone can perform a required task at a target level of proficiency, they are competent. So how to become a competent? So of course, you must be able to react to a situation and follow through behaviors you have found and succeed in the past. So to do this, you must have a repertoire of possible actions to take and training in them. So competency grows with experience and training. So for For this too, you will become competent. Okay, so next is commitment to provide high quality service. So like education, healthcare also needs to be given importance. So how? First is improve safety. So how do we improve safety? It is by taking measures to make medical mistakes less frequent and less harmful. So I always tell this to my students before, that as a health professional, there should be no room for error, because the lives of our patients is in our hands. Next, improve clinician. And patient interaction. So when we say clinician, this is used soon. So if a patient are satisfied with the interaction, they are likely to be more compliant with the treatment plan, and they will understand their role in the recovery process, and they will also follow through with the recommended treatment. Third is provide operational efficiency. So from handling patient's file. So in patient's file, it is very confidential. So we should not tell it to others who are not included in the team who is handling on a certain patient. Next, provide equitable care. So providing quality care to every patient regardless of race, social or economic status, or any other such factors is another way to deliver quality care in the healthcare industry, because every patient has the right to good health care, and produce to offer the highest quality care to all patients improves the quality of healthcare for everyone. And the fifth one, provide patient-centered care. So the center of the care should be the patient, and it is the focus of the health industry, because after all, the end goal is to curb whatever ails the patient or help the patient manage whatever can be cured. Thus, by offering patient-centered care, patients receive treatment specifically designed for them. So next is willingness to recognize and support the works of others. So if you're supportive and friendly, people are naturally going to feel more inclined to share things with you. So being an approachable person comes with its own benefits, because people are more likely to feel more at ease around you, and they will be honest with you and speak up whenever they have queries or questions. Next is dedication to meet the high standards. So quality standards set out the priority areas for improving quality in the health and social care. So in providing care, there should be a high standard. So we should provide by any means the care. For example, if you will be assigned in a certain area like post-operation, so the patients there are a high risk for infection, so there should be a high standard in providing intervention so that they will not acquire infections. Next, belief that necessary changes and improvements can be accomplished. So all health organizations, professional groups should adopt as their explicit purpose to continually reduce the burden of illness, injury, and disability, and to improve the health and functioning of the people. So healthcare should be safe. There, so avoiding injuries to patients from care that is intended to help them. Second, effective. So providing services based on knowledge and avoiding underuse or overuse. Next, again, we have here the patient-centered. So providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decision. Next is timely. So reducing waits and sometimes harmful delays for both those who receive and those who give care. Next is efficient. So avoiding any waste. So soon, if you will be working in a government institutions, of course, there are some points that there are some scarcity of equipments or supplies. We should be efficient in using those supplies. Then we have again here the equitable. So providing care that does not vary in quality because of personal characteristics such as the gender, ethnicity, geographic location, and of course the socioeconomic status. So next, willingness to serve as an example and complete whatever tasks are necessary for achieving the goal. So if you are to define the quality of care as care likely help patients and achieve their health goals, then goal-directed care. So goal-directed care would always certainly be the higher quality than problem-oriented care for several reasons. Interventions would relate directly to meaningful outcomes and they would be prioritized based upon impact. So by encouraging primary prevention, reducing irrelevant interventions, preventing clinical cascades, goal-oriented care should be safer. Why? Because goal-directed care would elevate the importance of understanding each person as a unique human being, and it would strengthen relationships and reduce prejudices that contribute to healthcare disparities. So next is ability to communicate effectively. So proper communication between the leaders and staff plays a key role in the success of organization because proper communication keeps people in the loop, involved, and feeling part of the team within everyone working towards a common goal. And ability to listen and communicate effectively in both speech and writing tends to make other things you are trustworthy and enhances your ability to motivate and lead. And more importantly, good communication skills lead to more positive patient outcomes. We have also higher patient satisfaction. And of course, have a better overall healthcare. So qualifications and abilities of a health professional. So to prepare to become a professional, so here are some. First is to have license to practice in a country. So here, license, very important. So if you don't have a license, your job is very minimal. So for example, in my case, I am a registered nurse here in the Philippines. So I can perform such the roles and responsibilities of a nurse here in the Philippines. So the initials usually, if you are a registered nurse, is RN. If you are a medtech, it's RMT. If you are a pharmacist, RPH. If you are respiratory therapist, RRT. If you are a doctor, MD, and many more. And of course, For you to attain this initials or license, you need to be or graduate of a Bachelor's of Science degree. For example, in my case, for me to take the board exam, I need to have a diploma of Bachelor's of Science in Nursing. Ayan, for MedTech, Bachelor's of Science in Medical Technologies. For Pharmacy, Bachelor's of Science in Pharmacy, and many more. And of course, for you to be a health professional, we should be physically and mentally fit. Now, the question here is, what if you have disability? So, does it mean you are not already eligible to be a health professional? The answer there is no, you are still eligible to be a health professional. It's just that you will be assigned in a certain area wherein you will be more effective. Then, of course, mentally, because the activities in the health industry is really strenuous. So, and stress. So, we should be mentally fit. Next, personal qualities and professional proficiencies. So, interest and willingness to work and learn with individuals or group in a variety of settings. So, here, it is the interprofessional collaboration. So when we say interprofessional collaboration, it is a multiple health workers from different professional backgrounds working together with patients, families, caregivers, and communities to deliver the highest quality care. So what are the benefits? First is improved patient care and outcomes. And each of the healthcare team has a unique perspective and valuable insights about the patient. So they will notice any different symptoms and consider different possibilities. So together, they will have a more comprehensive, holistic view of the patient. Next is reduce medical errors. So in healthcare, communication gaps can have closely consequences from missed symptoms to misdiagnosis to medication errors. So interprofessional collaboration in healthcare can help to reduce preventable adverse reactions, decrease mortality, and when we say mortality, that is death. And of course, optimize medication dosages. Next, start treatment faster. Okay, so much of the healthcare is a waiting game. Patient wait for physician, or while physicians wait for other physicians to provide consultation or for radiology to send back lab results. So if there is an interprofessional collaboration, it will right away start the treatment and it will lead to be a faster recovery of the patient. Next, reduce inefficiencies and healthcare costs. So, interprofessional collaboration in healthcare helps to prevent medication errors, improve patients' experience, and deliver better patient outcomes. Next is, it improves staff relationship. Might as well job satisfaction. So every health professional has its own subculture, knowledge base, and philosophy. So when you add power structures, some members' voices get prioritized over others, and that's not good for the patient or for the staff. So with interprofessional relationship or collaboration levels, the playing field and acknowledges that everyone plays a vital role on the care team. So the sense of the community and camaraderie can also boost staff relationship, staff retention, and recruitment. So next is warm personality and concern for others. So kindness is defined as the quality of being friendly, generous, and considerate. So affection, gentleness, warmth, concern, and care are words that are associated with kindness. So kindness has a connotation of meaning someone is naive or weak. That is not that the case. So being kind often requires courage and strength. Kindness is an interpersonal skill. So there are different ways to practice kindness. So one way to be kind is to open your eyes and be active when you see people in need. So next, resourcefulness and creativity, as well as well-balanced emotion condition. So our healthcare system has been changing quickly over past several years, and everyone, the patient, the physician, nurses, and other healthcare providers have been scrambling to keep up and learn the ropes as rules. The technology change. So as a professional, we should be resourceful and creative, most especially on the technology changes. We need to adapt in order for us to be effectively provide interventions to our patient. Because one of the key qualities that a healthcare provider is resourcefulness, and in healthcare, it translates to the ability to know where to find such information. So a resourceful healthcare provider is willing to learn, listens to both patients and professionals outside of his or her scope of practice, reaches out into the community beyond their immediate circle of professional colleagues trained in the same way, recognizes a patient in need, and known when to refer the patient to the appropriate resources. Next is capacity and ability to work cooperatively with others. So patients' safety agrees that communication and teamwork skills are essential for providing quality care. So when all clinical and non-clinical staff collaborate effectively, healthcare teams can improve patient outcomes, prevent errors, improve efficiency, and of course, increase patient satisfaction. It also promotes an atmosphere that fosters friendship and loyalty. So next is improve to self and service. So continuous process improvement encourages all healthcare team members to continuously question how they are performing and whether performance can be improved. So as they say, there is a room for improvement to become competent, and as what I've mentioned earlier, for being a competent or to become a competent through experience and training. So competence in performing work. So as previously mentioned, becoming competent at a skill allows you to perform it with ease, boosting your productivity, increasing your performance in the workplace. So improving the levels of your competency also gives you the ability to impart knowledge to others, improved competency in the workforce. So skills in decision making, communicating and relating with others, and being research oriented. So let me emphasize this: decision making. So you should be a critical thinker. So in critical thinking, it is an essential component of a professional accountability and care. Because if you're a critical thinker, it will exhibit a habit of mind, which is the confidence, contextual perspective, creativity, flexibility, intellectual integrity, intuition, open-mindedness, perseverance, and many more. So with critical thinkers in the health practice, the cognitive skill of analyzing. So analyzing and application. Standards. So you will have a logical reasoning, predicting and transforming knowledge. So active participation in issues confronting healthcare professionals. So clinicians and healthcare staff work tirelessly to care for their patients in an increasingly complex, inefficient, and stressful environment. As you all know what is happening right now all over the world, healthcare providers are really participating with the issue that many people are really involved in the coronavirus, to lessen the spread, to minimize the spread, and above all, to really eradicate already this pandemic. So healthcare or professional healthcare skills. So develop an in-depth understanding of your work. So learn as much as possible about the theories. So here, theories, once you're already in the first year college, you will be introduced with many theories which will help you and guide you in delivering interventions to your patients that will support your skills. And with theories, it will increase the level of your performance and improve your decision making for you to be a critical thinker and, of course, a problem solver in the future. Next is observe and listen carefully. So question situations that do not seem right given the circumstances. So if you are a newbie, so you need to observe and listen carefully for you to gain those knowledge. And if you think that there's something wrong or there is something to question, you can ask your superior. Then consult the employee manual and or ask questions if necessary if you are unsure about the policy or procedure. So never assume in the health industry, because if you just assume, then you really don't know a certain procedure, something might happen to the patient. Then perform all work as neatly and accurate as possible. So of course, we need to be neat and accurate in delivering interventions. For example, neatly, if you will be handling a patient and there is a wound, so neat in terms of dressing the wound, accurate in terms of providing medication. So what is the amount or what is the dosage, most especially if the medication will be given intravenously. And when I say intravenously, that is direct in the blood vessel. And of course, dedicate time to acquiring new knowledge and skills for you to become competent. So professional handling to difficult situations. So healthcare workers sometimes deal with challenging and stressful situations. So this is very true. As a health professional, the work is really stressful. So it is natural to react emotionally. And when faced with an emergency, the death of a child, or an angry patient. So such response, however, can be interfere with the worker's effectiveness. So let me just share you this, that I had just finished my affiliation at St. Paul Hospital, and when I was assigned at medical intensive care unit, first day it was really stressful and it's very traumatic. Why? Because upon entry on the medical intensive care unit and when they endorse the patient to me, we already declared a code blue to the patient. When we say code blue, blue means oxygen. So the level of oxygen on the patient is really dropping abruptly. So we need to perform such intervention. So what I did was I provided cardiopulmonary resuscitation, manual ambubagging, intravenous medications to the patient for them to revive. But unfortunately, the patient died. So it's very traumatic and emotionally. So if that's the situation that you'll you will be into, you need to be strong, control your emotion. So criticism, acceptance. So criticism and correction can be valuable learning resources. So these opportunities to learn are often lost because it is hard for people to admit that they might be wrong. So it is common to react defensively in this situation and miss the message. So if your seniors will criticize you, do not feel bad. Take that as learning, because most especially if you are a newbie or new to a certain area. So that is a way for you to learn. So responding gracefully to criticism is a sign of professionalism and of course self-confidence. So healthcare workers who feel secure about themselves are comfortable with suggestions about their work and conduct. So they're able to evaluate the information received and decide if it applies to them. So that's all for healthcare as a profession. So I hope you've learned a lot with this topic. And before I end this session, I have this short video presentation. And thank you so much. God bless everyone. Stay safe.
That was really interesting because it felt real. Seeing how real people would react. I thought it was really, really just amazing.
So this is the first Youth Career Day that we're holding here at the Garfield Center.
We have over 150 students here today from the Bay Area and the Sacramento area that have expressed an interest in a healthcare profession.
In addition to nurses and physicians, we were able to profile 26 different professions.
The partnership with Kaiser Permanente in our school is wonderful today. Not only are they helping kids have a future, this is actually showing them the different careers they would have never even thought of.
We had 5 scenarios. We started with urgent care.
What I'm going to do is just take a look at your ankle, okay?
When they did the reenactment of the patient who had broken his ankle, they wanted us to see that it's not all just about being doctors and nurses.
They had like tons of different careers. I saw a medical assistant, a receptionist, a phlebotomist, a EKG tech.
I've never actually been in an OR room, so I thought that it was really interesting going in there and actually touching everything because I know everything has to be sterile.
This is called a sterile field.
They'll actually be participating in a simulated operating room experience.
So this role here is an anesthesiologist, which is a physician.
Each person in OR has a specific job.
I just felt like I was actually there. I could see myself there, which was really fascinating.
Then they had labor and delivery experience where we had one of our simulated mannequins do a delivery.
Okay, I just gave you some medicine. I was trying to like calm the patient down, so it was fun.
What I learned about when it comes to patient care is that you always have to care for your patient. You always have to have the ability to want and make them feel comfortable.
Kaiser's really very committed to helping to increase the diversity of the healthcare workforce. And an event like today helps students who may not have a sense of where they truly can see themselves.
You always have to have the drive and motivation to make sure that this is what you want to do and this is what you love doing. And I'm interested in becoming a registered nurse.
The experience today reinforced the fact that I want to be an OBGYN. It would take time, but I know that I could be there. And yeah, it helped me to see myself there. I feel like my dreams aren't that far.
I think today says about Kaiser Permanente is that their focus and energy is really on keeping people healthy, and it's really on giving back to the community.